If a kid was crying, about say a year old, belly's distended, stools are coming out, little red gelatinous, what would come to your head?
Intussusception.
What is intussusception?
Intussusception is when one part of the colon telescopes into another part. The surrounding outside part doesn't allow the blood supply to go to the inner part, and the inner part actually dies, and that's the blood, called current jelly stools. And you have the actual necrosis of the inner loop.
Okay, and how's that handled?
Normally, the first thing they do is they try giving a barium enema, in which they give barium, which is a liquid dye, to force the two apart. They will try 3 times. They'll try it holding the bag at a height of 3 feet so that you get some pressure to push the colon through with the dye. If that doesn't work, they have to go to surgery.
So in other words, the radiologist one of the few times is actually performing a procedure not to make a diagnosis, but to cure a kid of a particular problem. If they do get intussusception, does it come back?
It depends. If there's something called a lead point, like a polyp, if you have a polyp on the inside, which is like a lollipop, the stool can pull the colon into the other part of the colon. So if you have recurring polyps, you could get recurring intussusception, but it's...
There was a vaccine that was taken off the market, a rotavirus
Yes.
vaccine that I think 70 kids died from,
Right.
and they had intussusception, I think. The new Rotatech, we're getting it again, but we know about it in advance, so we're not seeing the deaths, but that's some concern after that vaccine. Some kids are getting intussusception. So here's a one time you use a vaccine, you have a little bit of a red flag of concern down the road. Is that correct?
Yes, and that vaccine is an important one because rotavirus is a major cause of death from diarrhea and dehydration.